Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in their profession. Today we are going to see about the competitive examination questionnaires on the subject medical surgical nursing. So the nursing aspirants who are preparing for the competitive examinations like JIPMER, NORCET, if you find this page to be useful, like it, share it and subscribe it. I have picked certain questions which was frequently asked in the previous year competitive examinations. So without wasting much time, let's get started into the questions. The first question is medical management for increased ICPR. So ICP means intracranial pressure. So administer mannitol. Option B, administer half strength saline. Option C, administer plasma volume expanders, and option D, reduce the number of breaths in ventilator. So for medical management for the increased intracranial pressure, we have to administer the diuretics. So once we are administering the diuretics, it is going to reduce the cerebral edema, so thereby reducing the intracranial pressure. So among these options, the diuretics is administer mannitol. So the option A, administer mannitol, is the correct answer. So this is a osmotic diuretics. It is going to decrease the cerebral edema. So thereby it is going to decrease the increased intracranial pressure. So how it is going to decrease is by increasing the urine output of a patient. So that is option A, administer mannitol. So next question is movement of joint away from midline of the body is called A, adduction, B, abduction, C, addiction, and D, adhesion. So from these questions, in a given formulas, the two options we can omit very easily. Like for example, option C and D, it is not related to the question. So we have a confusion on option A or option B. So option A, adduction, or option B, abduction. So here movement of joint away from the midline, it is called option B, abduction. Abduction is defined as movement of the joint away from the midline. So we'll see one picture here, movement picture here. See here, the in image it is going away from the midline. Okay, if it is coming towards the midline, it is adduction. If it is going away from midline, it is known as abduction. So next question, nurse understands that which of these following factors is most likely source of delta hepatitis. So here they have not mentioned whether it is hepatitis A, B, C or D. So but in the question they have given delta hepatitis. So we should know the other name of the delta hepatitis so that it is be easy for you to answer the question. So A, practicing poor hygiene, and option B, eating infected shellfish, and option C, overly exerting oneself, and option D, receiving a blood transfusion. So here in this question they have mentioned about the source of infection by delta hepatitis. The delta hepatitis is also known as hepatitis D. So here hepatitis D is effective only when a person have hepatitis B. Okay, so if the hepatitis B is not there, the hepatitis D, that is delta hepatitis, is going to be ineffective in a patient. So what is the route of infection in hepatitis B is parenteral route. So only when we are administering the vaccination against hepatitis B, it is going to protect the person against the hepatitis B and hepatitis D. So here according to this question, which is the mostly like source of delta hepatitis is receiving a blood transfusion. So D is same as that of hepatitis B, C and D occur due to the parenteral infections like intravenous fluid infection, like that. So according to this question, the answer is option D, receiving a blood transfusion. Okay, let's move on to the next question. A client has just returned to a nursing unit after above knee amputation of the right leg. A nurse suspects the client in which of the following most appropriate position. So here in questions they have given that soon after from the operating theatre, the patient is received in the post-operative nursing unit. Okay. So soon after we are receiving the patient from OT, which position we have to give. So they have given that the patient underwent above knee amputation. So option A, supine in stump flat of the bed. Option B, supine with stump elevated. Option C, reverse Trendelenburg position. And option D, prone position. So soon after, when we are receiving the patient from the operation theatre, we have to provide a supine position with stump elevated. Stump is nothing but we have given amputation to the above knee, no? So that is known as stump. So the correct answer is option B, supine with stump elevated. So for first 24 hours we have to give that position. So after 24 hours to 48 hours only we have to provide a flat position to prevent the hip flexion contracture, because for first 24 hours we have kept the elevation of the stump, no. So after 24 hours we have to keep it in a flat position to prevent hip flexion contracture. So next question, locking of knee as a symptom means. So what is mean by locking of knee? So option A, suddenly inability to extend, sudden inability to flex. Option C is stiffness of knee, and option D, screw home movement. So locking of knee means it is inability to flex as well as extend. So in the given option they have given, in option A they have only given about extend, and option B only flex. But whereas option C, stiffness of knee, which consists of both inability to flex and bend, or flex or extend. So here the correct answer is stiffness of knee. So locking of knee refers to inability to flex and bend. Next question, how many cervical nerves are in spinal cord? So before answering these questions, we must know how many nerves are there in cervical, how much is there in thoracic, how much is there in lumbar, sacral and coccyx. So we must know that 8:12:5:5:1, that ratio, so that it will be easy for us to understand very easily. So here the option is 8. So we must know how much cervical nerves are there in spinal cord. So a simple mnemonic like CT lumbar, sacral coccyx, like that you just remember. So that CT means cervical. Cervical is 8. Thoracic means 12. Then next is CT lumbar. So lumbar is 5. Again sacral is 5 and coccyx is 1. So that it is easy for us to remember those nerves of the spinal cord. So if they are asking about lumbar, we can tell so how much it is, like 5. If they are asking about the thoracic nerves, we can answer like, so it is a 12. So before this is all are the direct questions. So we have to by heart how many cervical nerves are there in the spinal cord. It is about 31 pairs we have, and for each and every cervical, thoracic, we have their own nerves. The next question is, the most common lung cancer seen in non-smokers is. So here they have mentioned about the common lung cancer for which type of people, that is non-smokers, that is passive smokers or second-hand smokers. So option A, adenocarcinoma. Option B, squamous cell carcinoma. Option C, large cell carcinoma, and option D, small cell carcinoma. So we have mainly for the smokers, it is due to the tobacco use. We have 4 types of carcinoma, like squamous cell carcinoma, adenocarcinoma, small cell lung cancer, non-small cell lung cancer. So among non-smokers, which is more prevalent is, it is option A, adenocarcinoma. So among non-smokers, which is the most common lung cancer we have is adenocarcinoma. That is the answer. So next question is, which of the following is most important tumor marker to diagnose carcinoma of ovary? So here they have asked about the tumor markers. So in any competitive examinations, they will ask about the tumor marker. So we must know what are the tumor markers which will be raised in certain kind of cancers or carcinomas. So option A, serum HCG. Option B, CA125. Option C, serum alpha fetoprotein. And option D, human placental lactogen. Here the answer is CA125. So how you will know the tumor markers? So like CA125 means it will be increased in case of colon, lung, breast and ovary cancer. Next is, if alpha fetoprotein is increased means it is a hepatocellular, that is liver carcinoma. Next is prostate specific antigen, it is raised in case of prostate cancer. Calcitonin will be increased in case of thyroid, and beta HCG will be increased in case of testicular carcinoma, and beta 2 microglobulin will be increased in case of chronic lymphocytic. So we have to know in which carcinoma what tumor marker will be increased. So in any question, in any competitive examinations, they are asking about the tumor markers. So we have to learn that. So next is Boxer's muscle is a option A deltoid muscle, option B is a brachioradialis, option C serratus anterior, and option D biceps brachii. So the Boxer's muscles is otherwise known as big swing muscle. So from these four options, the option C serratus anterior is the correct answer. Why? Because it pulls the scapula forward and around the rib cage. So it is known as the Boxer's muscle. So next is drug of choice for myasthenia gravis. So what is going to be the drug of choice for myasthenia gravis? Option A adrenaline, option B atropine, option C neostigmine, and option D tibocurarine. So here we have to, in case of myasthenia gravis, we have to administer the anticholinesterase. So among these four options, the neostigmine is a anticholinesterase. It is going to improve the muscle strength by improving the acetylcholine. So we are going to administer the medications which is going to give the muscular strength by increasing the acetylcholine and decreasing the cholinesterase, that is anticholinesterase drug. So that's all about today's medical surgical nursing multiple choice questions. So this questions has been picked based on the previously asked questions in the competitive examination and frequently asked. So if you have scored 10 after 10, it means that you are preparing well for your examinations. So prepare well for your examinations and get selected into any kind of competitive exams. So if you like the video, like it, share it and subscribe it, and thank you for watching the Nursing in Handy channel.